Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and in today's course, I will be discussing about monkeypox. I will be talking about the various aspects of monkeypox, including its diagnosis, the management, the vaccine to control it, whether monkeypox is becoming a new concern to the medical world, and what WHO has to say about it. Human monkeypox was first reported in humans in 1970 in the Democratic Republic of the Congo in a 9-month-old boy in a region where smallpox had been eliminated in 1968. Now, monkeypox was caused by monkeypox virus, which is a member of the orthopoxvirus genus in the family Poxviridae. Now, monkeypox is usually a self-limiting disease with the symptoms lasting from 2 to 4 weeks. However, severe cases can still occur. Monkeypox is a viral zoonotic disease that occurs primarily in the tropical rainforest areas of Central and West Africa and is also occasionally exported to various other regions. Now, an antiviral agent developed for the treatment of smallpox has also been licensed for the treatment of monkeypox. Vaccines used during the smallpox eradication program were known to provide protection even against monkeypox. However, newer vaccines have been developed, of which one has been approved for prevention of monkeypox. A WHO report reveals the facts of the disease. In recent times, the case fatality ratio has been around 3 to 6%. Monkeypox is transmitted to humans through close contact with an infected person or an animal, or with material contaminated with the virus. So this virus is transmitted from one person to another by close contact with lesions, body fluids, respiratory droplets, and even contaminated materials such as bedding. The invasion period is around 0 to 5 days, which is often characterized by fever, intense headaches, lymphadenopathy, back pain, myalgia, and even intense asthenia. Lymphadenopathy is a distinctive feature of monkeypox compared to other diseases that may initially appear similar, that is chickenpox, measles, or even smallpox. The skin eruption usually begins within 1 to 3 days of the appearance of the fever. The rash tends to be more concentrated on the face as well as on the extremities rather than on the trunk. It affects the face in about 95% of the cases and palms of the hands and soles of the feet in about 75% of the cases. Also affected are the oral mucous membranes in about 70% of the cases, genitalia in 30%, and conjunctiva in 20%, as well as the cornea. So the rash evolves sequentially from macules to papules to vesicles, pustules, and crusts, which eventually dry up and fall off. The number of lesions varies from a few to several thousand of them. In severe cases, the lesions can even pulsate until large sections of skin slough off. Hence, creating awareness of various risk factors as well as educating the masses about the measures they can take to reduce the exposure to the virus is the main preventive strategy for monkeypox. So during human monkeypox outbreaks, close contact with the infected persons is the most significant risk factor for developing a monkeypox virus infection. Healthcare workers and household members are definitely at a greater risk of infection. Health workers caring for patients with suspected or confirmed monkeypox virus infection or even handling specimens from them should implement standard infection control precautions. All patient specimens must be safely prepared for transport with triple packaging in accordance with the WHO guidance for transport of infectious substances. Unprotected contact with wild animals, especially those who are sick or dead, including their meat, blood, or various other parts, must definitely be avoided. It is known that human-to-human transmission is limited, with the longest documented chain of transmission being 6 generations. What does that mean? Now, this means that the last person to be infected in this chain was 6 links away from the original sick person. It can be transmitted through contact with bodily fluids, lesions on the skin, or on internal mucosal surfaces such as in the mouth or throat, respiratory droplets, and even contaminated objects, as I previously mentioned. Therefore, close contact with these bodily fluids must be avoided. Detection of viral DNA by polymerase chain reaction is the preferred lab test for monkeypox. The best diagnostic specimens are directly taken from the rash, that is the skin fluid or crusts, or even the biopsy wherever it is feasible. Now coming to talk about vaccination. Vaccination against smallpox had previously been demonstrated through several observational studies to be about 85% effective in preventing monkeypox. Now, evidence of prior vaccination against smallpox can usually be found as a scar on the upper arm. Now, presently, the original, that is the first generation smallpox vaccines, are however no longer available now to the general public. Some lab personnel or even healthcare workers may have received a more recent smallpox vaccine to protect them in the event of exposure to such an orthopoxviruses in the workplace. However, a still newer vaccine based on a modified attenuated vaccine virus, which is the Ankara strain, was approved for the prevention of monkeypox in 2019. So, smallpox and monkeypox vaccines are developed in various formulations based on the vaccinia virus due to the cross protection afforded for the immune response to orthopoxviruses. So, keeping all these views in mind, it is therefore concluded that monkeypox is less contagious than the smallpox virus and causes less severe illness. Monkeypox typically presents clinically with fever, rashes, and swollen lymph nodes and may lead to a range of medical complications. However, to confirm this, more studies and vaccines are definitely to be developed to completely eradicate this new disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.